Ladies and gentlemen, thank you for your patience in holding. Please be aware that each of your lines is in a listen-only mode. It is now my pleasure to turn this conference over to Chris Hund. You may begin.
Thanks, Chantel. Hi, everybody. Welcome to the November 2020 AHA Team Training Monthly Webinar. This month is Same Storm, Different Boat, using TeamSTEPPS strategies to navigate the uncharted waters of virtual learning. So definitely lots of storms going on right now, right? So I think this will be a really timely webinar for you all today. My name is Chris Hund. I'm a Senior Director with the American Hospital Association Center for Health Innovation, and I'll be your host today for this webinar. Just some quick rules of engagement. You can listen to audio two different ways, through your phone, and if you do that, please mute your computer speakers or listen through your computer if you have a solid internet connection. All hyperlinks you see are active if you click on them, and we'll open up another window so you can look at things later on. And we'll do a Q&A session at the end of the presentation. So we would love for you to use that chat pod that a lot of you are using right now to say hello throughout the presentation to ask questions. We might answer those questions as we go, but if it's something that we think will really lead to a good conversation, we'll save it to the end for our Q&A session that we'll do. You could also see on your screen right now that there is a pod that says Files. That's where you could download different things like instructions and handouts, and then there's also some web links that are already in that other pod. To receive one continuing education credit hour for this webinar, you'll need to create a Duke OneLink account. Duke University is our partner for continuing education. And if you've already done this in one of our previous webinars, you're not going to have to do it again. So follow the instructions here. There are instructions in that Files pod to download if you'd like. And then you'll see a code on your screen right now that you'll text to the phone number on your screen after the webinar completes today within a 24-hour window period. We'll put that code and phone number back up on the screen at the end of the webinar. Just some announcements. We actually have a lot of upcoming events. So we have a new workshop that you can sign up for. It's teaching non-clinical TeamSTEPPS. So this is a 4-week workshop, and what we want to do in this workshop is to really give you the tools to help grow your non-clinical team in using TeamSTEPPS. So you might be a really strong TeamSTEPPS program clinically, and you think to yourself, it would really be wonderful to get all of our non-clinical partners in our health system or in our school or in our clinic all on the same page. So this workshop's for you. It starts next week, so you'll want to get on right away and get registered if you want to be a part of it. There's limited spaces left, but there are still a few spaces. We have a bonus sponsored webinar that is going to take place on November 18th, so 7 days from now, from 1 to 2 p.m. Eastern Time. And that webinar is going to be improving the patient belongings tracking workflow to increase patient satisfaction. So that's been a focus in very much on what happens to patients' belongings when they're in the hospital. And then our next monthly webinar is going to be on December 9th, and that's engaging patients and families as safety champions and change leaders. So 2 extra free webinars for you coming up before the end of 2020. Okay, now I'm going to get right to the main event today, and I will introduce our speakers. So we have 3 today, all 3 of them from Ursuline College and the Breen School of Nursing and Health Professions, which is outside of Cleveland, Ohio. We have Laura Goliat, who's an associate professor, Patricia Sharpnack, who's the dean and the Strawbridge professor, and Phyllis Kronk, who's an assistant professor. This is a team that's been working on TeamSTEPPS and other team training related things for a very long time. They've been partners of ours for years, and so We're really looking forward to hearing from them and from hearing from Cleveland. So without further ado, I'm going to toss it over to the team.
Thank you so much, Chris. We really appreciate your introduction and also being back with all of you. It's a thrill to be back with your team at AHA. And today we're going to be talking about a variety of different things, but about some of the challenges of transitioning to the virtual learning environment that occurred earlier this year. And we're going to have you identify at least one online TeamSTEPPS integration strategy to engage your virtual learners. And finally, describing an interprofessional experience embedded with TeamSTEPPS tools and strategies to engage your virtual teams. So I'm going to start off talking a little bit about what happened to us in the spring. And who would have known that the International Year of the Nurse and Midwife, that the challenges before us would be so vast and so complex. As educators, we only need to look at the past 10 months to marvel and celebrate the victories and the quick pivots in what we considered unchartered territory. Most academic programs, like us, moved from in-person to virtual learning, from in-person clinical to virtual simulations mapped to the curricula within just a few days. Technology was readily incorporated and enhanced remote student classroom experience introduced as the new normal in instructional design. What was interesting that this demonstration of agility in a time of crisis, it dissolved some long-held assumptions about how much time progress takes, specifically in the long-supported bastion of higher education. Yet, we have been somewhat trusting about our ability to succeed. But we have really realized that some of our academic outcomes are still at question, and that impacts our healthcare partners. Here in Cleveland, Ohio, and I am certain throughout the nation, new graduate nurse and all healthcare workers' preparedness has taken a significant impact. This exceptionally disruptive time has impacted the Academy's paradigm, and really we have identified gaps where competency versus content must be the goal. So reevaluation of priorities and expected outcomes of our graduates, regardless of which profession we are educator for, needs to occur. Knowing what we know now, we cannot go back. So what we found that COVID-19 had a significant impact on our new graduates and nursing students. The loss of clinical, class, and laboratory time influenced the ability to effectively transition to clinical practice the following semester, and we didn't realize how significant that would be. Many of our students were essential workers throughout this pandemic and throughout the closure, so they had to be at work. They ended up with a lot of Zoom fatigue and were unable to concentrate due to the pandemic. So transition to practice took additional time and effort on the part of our practice partners when they finally did get back to clinical. The impact on faculty and delivery was also substantial. Balancing home, family, and all responsibilities during the lockdown while trying to map virtual clinical experiences to program and course outcomes was stressful. Learning how to establish new remote rules, engaging students, and staying engaged as faculty was very difficult. There was a lot of moral distress on the part of our faculty about graduating and advancing students who are not necessarily prepared for the next level or where transition to residency was questionable. Some of our faculty we lost, primarily because of the pandemic, who because of family fear or moral distress could not continue in their role. But this time has significant implications also for the future. COVID-19 has impacted education and nursing education significantly. The pandemic magnified some deficiencies in our system in the education of our students to not only know but do the work of nursing. So in many ways, this is where TeamSTEPPS comes in. Operationalizing competencies for leadership, transparent communication, a shared mental model, and situation monitoring. The old leadership model of VUCA, volatility, uncertainty, complexity, and ambiguity, can certainly be said to have ruled during this time. But I would argue that a new VUCA, vision from strong leadership, must counteract volatility. Understanding the climate or a shared mental model to address uncertainty. Communicating with clarity to counteract complexity. The hallmarks, each of those, of TeamSTEPPS training. And finally, having the wherewithal for agility and adaptability, or what we might consider situation monitoring, to lead during this time of uncertainty. These are the constructs. What a great tool to integrate now more than ever. So as I mentioned, the impact on students and faculty has and continues to be substantial. We did not have a playbook to facilitate our decision-making. We pivoted the best we could to address the impact of the pandemic and the lockdown using principles learned in TeamSTEPPS. To be transparent, in the process we realized that some of our infrastructure was lacking. We had students who were primary breadwinners. We had lack of adequate technological support. We had students that didn't have access to technology or the internet. Our faculty had limited knowledge on the neuroscience of learning and the impact of digital learning on students. We also realized the impact of isolation, limitation with digital resources, the lack of human connection, and loneliness. All of these factors impacted student and faculty engagement and ultimately learning. What changed during the pandemic with limited exposure to the classrooms and the lockdowns was the difficulty in assessment and transfer of knowledge from the classroom to clinical practice. We had to reevaluate how we could have good outcomes in a virtual format. So that we found that between the academy and practice, we weren't in the same boat and really in the same storms in some cases. We might look at the pandemic as a one-size-fits-all approach, but the pandemic has been far-reaching. We have tried to sail on our own comfortably constructed boats without evaluating how we might use a fleet instead to navigate the waters. We began recently to evaluate how could we use our TeamSTEPPS principles to influence outcomes. Could use of adaptive strategies address the learning needs of complex environments such as healthcare? We had to decide what was the critical outcome that we expected from our students, regardless of the delivery method. What would we expect and demand of our students? If communication is the number 3 reason for medical errors, we need now more than ever to integrate TeamSTEPPS training and competencies as the expectation of our outcomes. So as we look to the future, we need to evaluate our ability to transition our students to clinical practice with expected outcomes, how we can pivot for future pandemics or disruptions to ensure competencies despite mode of delivery. And we have to remember that our medical colleagues have used what they call entrustable professional acts, EPAs, to help address competencies. How can all healthcare provider educators begin to use this type of framework to own the outcomes of our students? Our changes this summer and fall include remediation. We did additional support and partnerships with our practice community to support transition to practice. And our plans for change include faculty development and a redosing of TeamSTEPPS strategies to allow for additional support in developing student competencies. So our next steps are to design creative models to facilitate learning and to connect theory and clinical, to design higher levels of competency assessment to ensure whether virtual or face-to-face we are preparing residency-ready graduates. We have to keep in mind that patients first and safety always are a mandate and not an option. Therefore, our faculty are committed to the new paradigm that we must embrace in the new world of COVID-19. TeamSTEPPS has been an integral part of this paradigm, and there are many ways to assimilate the training into our programs and clinical sites. Dr. Goliat, my colleague, will take you on a journey of the strategies that we have implemented using TeamSTEPPS to influence our students and ultimately patient outcomes. Dr. Goliat?
Thank you, Pat. So how do we pull up the anchor and find those calm waters to effectively engage the online teams as they learn in ways to maximize learning, hold their attention, and engage them in owning the importance of learning how to become effective team players? Our new reality, quite frankly, will likely be using some level of online learning in the future for convenience, for cost, reaching larger groups of learners at a time, efficiency, time saving, etc. This can involve pre-reading, group breakouts, use of active learning strategies such as gaming, collaborative activities, and idea sharing. So many of us are in uncharted virtual waters that, quite frankly, are at first really uncomfortable in some cases and challenging. I know we are a work in progress and trying different things. Some stick, some don't. Let's talk about some tips that and lessons learned that we've seen. Number one, practice. Try things. It's okay to make a mistake. Get comfortable using different platforms. We found that platforms that include virtual breakout rooms are really important for online team training. Number two, start simple with pre-reading and simple icebreakers. Number three, get learners engaged. Keep it fun. Icebreakers, as we see in the AHA team training sessions, icebreakers at the beginning and strategically placed throughout are key to set the tone, keep this tone, and encourage participation with heightened engagement. Number four, structure. Have some form of structure. Start with an icebreaker, include TeamSTEPPS content, theory bursts with interspersed activities, and number three, application and measurement. Number five, keep it relatable. Icebreakers, whether TeamSTEPPS related or just getting to know your team or your team members, whoever's online in that environment. What was your first job? Or an icebreaker that requires choice, dogs or cats, coffee or tea, or the never have I ever games, such as never have I ever what? Bungee jumped, etc. Share the whiteboard if possible for activities. Put individuals in teams and have them answer questions in pre-designed circles that you create. And number six, assess. Always important to measure our learning strategies. And you can do that through quizzes, Kahoot, Google Forms, learner reflections, polls within the video conferencing format. So let's take the plunge together. We must be agile and flexible, as Pat said. Remember, we have great evidence-based content provided by AHA Team Training, TeamSTEPPS Pocket Guide, Research and Evidence, TeamSTEPPS Curriculum with videos and materials, video-triggered teamwork, training, and now Mighty Networks. So hang on, think out of the box, and by using our AHA Team Training resources, coupled with activities and analogies, we are in smooth waters for sure. So let's look at icebreakers. Let's talk ideas. Their importance, as we all know, cannot be emphasized enough to set the tone for your team training and welcoming learners in. In TeamSTEPPS, we've historically used and effectively the chain link or Legos, to name a few, which are excellent icebreakers and much loved. But let's talk about some we can also use for online experience. The dice you see in the upper left-hand corner. So the instructor rolls the dice. There are 4 sets of questions that correspond with a certain number on the dice or the die. Questions may include either TeamSTEPPS related questions or simply, if you could eat only one food for the rest of your life, what would that be? So real icebreaker type questions. The dice is rolled. Learners are assigned either breakout teams or groups, or they can use the chat box to answer. Another one would be alphabet. Give each group a letter to come up with team, whether effective or non-effective characteristics. They can utilize that. The use of polls to engage everyone, as you see here, and assess learning, very important. the simple Simon Says game. And this may be a wellness break for your teams. To stand up, the leader starts, obviously, Simon says stand up, and then on, and maybe touch your nose, etc. The physicality of that, we have found that has been really, really vital to keep the day moving. And another, a team problem-solving activity. Break out your learners into teams and give them a problem to solve, like the stranded game. Your team is about to be stranded on a deserted island. They have to collaborate and come up with 3 things only that they would take and why. That's an example. And then thumb games. Have learners give thumbs up or down. You can do this in gallery view or with every learner on the screen if it's fairly limited. Or use of the thumb ball, so that imaginary ball is tossed from learner to learner. And you can include TeamSTEPPS language and definitions. This can be pulling it together or at the beginning with questions like non-TeamSTEPPS related, such as what's the most useless thing in your house, or what would your superpower be. So just some examples of icebreakers that perhaps maybe you haven't utilized yet, or even some oldies but goodies. When we look at the first construct, overarching team structure in TeamSTEPPS, there's many examples that can be found right on YouTube as short clips to view and debrief on. And some of them are pictured here, such as a racing team video where teams can dissect the roles and responsibilities they see. Nature and animals, huge for examples. And if we look at geese, why they fly in formation, how they take turns as leaders, what they do when one gets tired or sick, demonstrating the construct of even mutual support. There's other videos, obviously. Boat racing is great, dissecting the roles assumed and preparing for races, sculling, team precision, where synchrony matters, team dynamics observed in these examples. So all good examples and good talking points. Also the life of ants, crabs, and penguins we found. And you can get kind of combined videos on those in YouTube, but they're great talking points to pull out the TeamSTEPPS constructs and tools and strategies. So leading teams. So if we look at leading teams, there's many, many examples out there of effective leadership and non-effective leadership, and they can be found in short film clips. Obviously, from YouTube is the easiest way. In looking at one of our favorites, it would be Apollo 13. You'll remember this to be the emergency land in space occurring in 1970 when an oxygen tank explodes in space, power decreases, and it's life-threatening. So you have 2 teams there, one in space, one on the ground, that must overcome emotional friction, problem solving as a team, and many, many other areas of leadership values and principles, especially situational leadership, where another leader emerges with expertise needed at the time. So it is a great film to access, as these others are, to demonstrate examples of TeamSTEPPS tools and constructs. And then, of course, wrong leadership. And you'll know if you've ever seen the Office clips, and as Pat said, with the devil wears Prada, that's almost abusive. So it's good to bring in both effective and examples of ineffective leadership. Mutual support. Examples include our beloved penguins, who must support each other and live in teams in order to exist. And these are their warmth huddles. The geese, again, are back. When one gets sick in flight, they don't go down as one. They stay. Some goose goes with them and attends to their needs. Also, their wings in flight together add 70% or more power when they're in formation than if alone. And then perception pictures, optical illusions, if you will, respecting others' points of view. Is the cat going up or down? That's a popular one right now. Communication construct, some ideas. Use of the clap feature, or physical clapping. Tell a story. If they hear a TeamSTEPPS construct in the story, they clap once or they point left, etc. We have self-developed videos. They're very short, and it's effective versus ineffective, and they work very, very well. They're actual examples from practice, and I know we all can come up with those. One in that grouping is a bad S-bar handoff. So students or your learners are able to see the video and actually come up with a solution, and then they see the right way to respond and what would be an effective S-bar. Okay, and then the snowflake exercise, we've used that quite a bit. You can do that virtually very easily. Have learners take an 8x10 blank piece of paper, and you provide directions to make a snowflake. They don't even need scissors. They can tear off a corner, etc. And then you hold up the right one per the directions, and I can assure you there will be a million variations when they hold up theirs. And so good talking points for communication. Situation monitoring. So if we look at situation monitoring, there's many ideas out there, such as the perception pictures. What do you see? Is it Goliat? Is it two profiles? The hidden pictures, find the animal or changes in the room. The Mentalist has a lot of really brief YouTube clips, awareness tests, the power of observation. This one happens to be football players. In white, how many in white make passes? So you count them, but do you notice the cheerleader doing backflips in the middle of them at the time? And then find the ball under the cup. And you could just play that video and people can guess in the chat room. Some examples of YouTube very, very brief clips that you can show online, and again, it generates a very rich briefing session. And then the penguins. There's many, many film clips available highlighting the habitats and behaviors of penguins in teams, especially from National Geographic. So know that those are available for you as well. So when we look at some interactive games, we've had fun with these. They can be used as icebreakers or kind of pulling together pieces, or kind of almost like a refresher break. We went to myfreebingocards.com, and there's others out there, but this gives you free cards for up to 30 players. And quite simply, you just go to the site, you choose 30 cards, you create the cards. There's a link that is generated to send to players or your learners. They click the link, a random card appears, and they play right on their phone. And they can actually generate X's right on their phone. So as you can see here, one idea would be providing practice examples of the TeamSTEPPS tools. TeamSTEPPS Jeopardy, I'm sure many of you have used this interactive game. There's many free online templates, as you'll know. I'll take ISBAR or SBAR for 500. The clue, this patient was admitted 2 days ago with a bowel obstruction. The learner, whether it be a hand up in the chat room, etc., would be, what is background? So you can really get creative with the Jeopardy game. TeamSTEPPS karaoke. Now this may seem complicated, but it really isn't, and it's a lot of fun. It really engages the learners, and they have to come up as in a breakout room as a team with a little song. So they're put into teams. They've got to collaborate to come up with a quick song in their own words, demonstrating TeamSTEPPS or a tool. There's tons of short instrumental clips out there via YouTube, and they just pull them up and they can record on their phones. But they have to collaborate first on what would be the words they would use. So we found the Sing King Karaoke YouTubes are great for this exercise. If you Google the song you want to use, just Google that and karaoke version, YouTube, it'll bring up some really interesting little songs. You have them construct a song maybe 1 to 2 minutes long in groups, and then they come back to the whole and they sing. So it's pretty fun. Things like the Piano Man, which you can see that they've come up with things about situation monitoring. Dancing Queen is another one by ABBA. Leadership demonstrates leadership. Stand By Me by Benny King. Mutual Support. Ain't No Sunshine for teams that have gone wrong, Bill Withers. And Imagine, John Lennon. Imagine a team that is effectively using TeamSTEPPS in their organization. Baamboozle, great site for the ability to generate games and also use existing games. So this is what that would look like. And lastly, this is one of our favorites as well, the TeamSTEPPS Wheel of Tools. There's something about seeing a wheel turning online. The anticipation, it really engages your learners. So you can create custom activities, quizzes, match up, word games on the word wall site. The template is provided and you just key in different TeamSTEPPS tools or definitions, and they answer things either in the chat room, as a team, online, and it keeps score for you. So just some ideas for increasing engagement in virtual team training learning. And again, these can be used within the TeamSTEPPS curricula for clinical, non-clinical healthcare professionals, as well as interprofessional learners. And now, Phyllis.
Thank you, Laura. Those are absolutely wonderful examples of the TeamSTEPPS tools. So, thinking about this, what does this look like in the classroom? How did this transition? You know, we moved along one day and everything looked great. We had all of our plans in place, and then all of a sudden we had to switch to this new virtual reality. So we didn't see that wave coming, and it certainly took us a bit off guard. We had planned at this time a just beautiful interprofessional education experience with our students, where nursing was going to work with pharmacy. We were going to have them share an electronic EMR record on site to do their chart review, work in their teams, do their assessments, make their recommendations. So all of a sudden, all the students are lined up and ready to go, and we have to switch to virtual. So how do you take all this? How do you put it into a virtual aspect? Well, we certainly enjoyed the wonderful options of Zoom. Everyone was very active with Zoom. So the first thing we decided is that in the spirit of the new VUCA, that yes, this is something we could do and we could tackle and we could make this a very effective experience virtually for our students. So we decided that we would utilize breakout rooms. We would have all the students sign into one main Zoom, and then we'd put them into their breakout rooms to work in their groups. That the pharmacy students that had access to the electronic EMR for the chart records would share that with the students and give a report to the nurses, and that we would be able just to kind of continue as we had initially planned. So some of the things that we weren't expecting was Zoom initiated. That's when they had all the difficulties with people kind of hacking into their different rooms. So Zoom changed their platform and had required at that point passcodes. But what we didn't realize is that that was also going to affect any Zoom meeting that had previously been scheduled. So we had lots of students that morning that had no idea of what the password was, and we had no idea that they needed the password. So that was the first barrier we had to overcome. So I think what you need to remember is whenever you're changing or you're moving into things, stuff's going to happen. And you just have to realize that and kind of continue to work through it. So we had a few instances where things didn't work out exactly the way we had planned. The pharmacy students didn't bring in their access to their electronic medical record. So the nursing participants didn't really have that initial information. And we started to realize pretty quick that we need to build a good blueprint for how to do these virtual experiences with the students, and also to really pointedly include some of the TeamSTEPPS principles. So we decided we can build that better boat with our TeamSTEPPS tools. So we reviewed, we looked, what do we really need to do? We certainly want to make sure that everyone within the IPE experience has the opportunity to receive a good brief, a good assessment. We have that opportunity to huddle, have that opportunity to communicate, and we wanted to engage them in the process of actually utilizing some of the TeamSTEPPS tools. So we had created, and I think you have available to you, a blueprint to a scenario-based virtual IPE experience via Zoom. A couple of the pieces that we realized working specifically with Zoom, that breakout rooms work very well. However, you need to do a few things up front. If you're going to be able to pre-schedule your students into a breakout room, you need to make sure that they register for the event and that they log into the event with the same email. Because if they log in differently, they will not be able to be automatically sent to those breakout rooms, and you will be manually assigning them at that point. But following the framework and following the blueprint, once we had made the Zoom meeting for everyone, we did our setup. We welcomed everybody into the brief, into the room, giving them a general overview of the patient's assessments and labs, so pretty much what they would see in that electronic chart. And then we would go ahead and send those students to their individual breakout rooms. As Dr. Goliat identified, it's very important to have some sort of a icebreaker. So these students start to communicate well with each other. They start to reach out and discuss things with the other members. So we did that with Zoom dating. So we asked them to first identify themselves, but then identify what they felt was most important, the most important aspect of their discipline. We also asked them to tell one thing about themselves that others may not know. So that can be very interesting. Sometimes it's very interesting to see who really likes to binge watch The Tiger King and who hasn't binge watched The Tiger King. So after that, the participants were to ask one question to one other participant from a different discipline. So this really provided a nice little icebreaker for them to start to get to know each other. It's important to send a message into the breakout room to let them know when you're winding up with that, because sometimes these icebreakers can go on for a little longer than what you'd like them to. So we do kind of have to move things along. After they've had their icebreaker, we have them go into their team huddle. Each discipline within the team received an update on that patient, a handoff report, if you will, that was specific to their discipline. So they all had a piece of the puzzle. They also were provided with a worksheet for questions that they had to work through during the experience. And on that, we also included an area for next steps, or you could call it the TeamSTEPPS. What we did is we had a patient that was presented that was a 52-year-old with a history of CHF. She had a history of MI 10 years ago and hypertension. The pharmacy students had their main focus on identifying the appropriate pharmacological interventions for this patient, while the nursing participants had a little bit more of an idea of the patient's background and history at her home. The course of the IPE was for the students to work together to identify not only the most current plan in the acute setting for the patient, but also to establish a discharge plan for the patient. Their worksheet had collaborative questions, so they had to work through this together. As they worked through it, they began to feel pretty good about the plans that they came up with, and that's when, to keep them engaged, we kind of threw in a surprise for them. We had someone enter into the breakout room, and we had them provide the students with a provider update. The provider had identified that the patient had nearly fallen in the morning getting out of bed due to the massive edema that was in her lower extremities. What the nursing had in their report, in their trends, is to see a declining blood pressure for the patient. The patient was trending down. The provider gives an order in error and wants to double the IV Lasix order, not realizing that the patient may have been syncopal, that the patient had poor orthostatics. So with that, we are very insistent with this incorrect order, and the students need to identify what are their next steps. So this is where they have to identify what TeamSTEPPS tools are they utilizing to counteract this order. When we leave with them, we tell them that they have to identify their next steps. They have to prepare then a handoff report to the shift coming in after them. We then ask them to identify the spokesperson for their group, so when we come into the main meeting, they will all collaborate together with their SBAR reports, and we will hear the different reports from the different teams. This is a great opportunity to talk about some of the differences and the challenges and the different outlooks that the different teams had. So we will all come back into that final debrief and review the outcomes, obviously wanting to know what went well. What would you do differently? So the students, have a good opportunity to really implement some of the TeamSTEPPS tools. We have found in giving this IPE experience that we really need to call out those opportunities to implement the TeamSTEPPS within our blueprint, because if we don't do that, sometimes the students will just tend to socialize a little bit to kind of come up with their plan and move on with their day. So it is good to definitely implement your interventions with cues for the TeamSTEPPS tools. So the students definitely enjoyed their IPE experience. They were able to do everything successfully via the Zoom in the virtual, our new virtual world. And that is pretty much how we went from that in-person to virtual reality as that big wave threw us off of that boat. So I want to thank you. If you have any questions, please let us know, and we are happy to address those.
Thank you, Phyllis, and Laura and Pat as well. It was great having you here. Really appreciate it. Oh, sorry, you got to do key takeaways. My apologies.
That's okay, Chris. But I'll come back to the beginning. I think the COVID-19 pandemic, while it's, and I hope you can hear me this time, while it's been very much of a struggle for all of us, it has created a new normal and has provided us with a lot of opportunities to be creative, to really reach our students in a different way. And I think what the key is right now is to make sure that we not only map the competencies, but ensure that the competencies that we have are aligned with what we expect our outcomes to be. And we do have a new VUCA. I think we need to look at things a little bit differently. And while it's been extremely disruptive, I think we have an opportunity to really change the dynamics of education and practice in the future. Laura.
And I would add that, and again, we are kind of navigating these new waters, and they're unchartered. And, how do you, engage teams online and really bring home the importance of that effort? So, creating virtual engagements, any way you can do that, and active and creative participation is key. Some of those areas that we talked about earlier, just practicing, start simple, getting learners engaged by the use of icebreakers and using some of the tried and true things that we've used in the past, such as Jeopardy games. It sounds simple and obvious, but anything can be transitioned to utilizing TeamSTEPPS constructs, tools, and strategies. Having a structure, keeping it relatable, and getting to know your learners. And by the way, those, if learners know each other, that's a whole different level, if you will. You're going to want to try something a little more basic and fundamental if no one knows each other on the online platform. So, you want to keep it relatable, and you use those icebreakers that are most appropriate for your learners. And then measurements. That's always a key, as we know, both in clinical or in practice as well as academia. Are we doing, or what we're doing, is it effective? So simple things like free online strategies, quizzes, Kahoot, again, Google Forms, learner reflections, polls within the actual video conferencing format. Very, very effective to just kind of intersperse those in a formative way and a summative way to assess what you're doing. And even have teams, online breakout teams, of coming up with their own icebreakers. So just a lot of different ideas, and I'm really, really grateful for the HA and the new Mighty Networks, especially because we can share our tools. Some of the things that worked, maybe even share some revisions of some things we've tried. So, again, we look at this online community. We look at the TeamSTEPPS community as really a family of educators in practice and as well as in academia, and so much we can share between those online resources and things that have really brought the TeamSTEPPS constructs and tools and strategies to life. Phyllis?
Yes, I see there was a question that did we create any expectations of the learner regarding their behaviors, attendance, appearance, etc.? And the answer is yes. Certainly all the participants were required to have their cameras on in the Zoom. They're also required to meet their clinical dress code. So they will look like the professionals they are. They're not permitted to be lying on their couches with their covers up, over their head and a cup of coffee in their hand. They need to present as they would in the clinical setting.
And I think that's one thing we did learn, because initially that the spring semester was very difficult and students were not engaged. The cameras were off. They were in bed. You could barely get any kind of interaction. So we really are learning through this process to in order to engage them and get the outcomes that we expect, we really do need them to be visible and think of this as a school day. And it's very difficult with Zoom fatigue, but we've really been pressing hard for those students to behave that way. Okay, Chris, it's to you.
Thank you. Great presentation. I very, very much appreciate it. It seems like people really were appreciating it too. There's been some questions that have been popping in about videos as well as different tools, and everyone please take take your attention to the links Jen's been putting in the chat about how to find those lists via both Mighty Network and some online Google Docs that we have available for people. There's a virtual activities section on Mighty Network that's really helpful, I think. I have a question that is something that there's been a lot of talk here about, keeping people engaged, making sure that the students are engaged, and how to do that. How have you, as educators or others that you know, perhaps included the students in that creation of how they want to see content delivered? Has anybody given the ownership, put the ownership or put the onus on them and said, okay, how do you want this to happen since we're all building a new boat together?
We actually have a student advisory committee, and I know that the faculty have individually, but through the broader group, we have a student committee that meets with the dean and the faculty. It's been difficult for them to identify because many of them have identified, that they want to learn remotely, but we have found that the outcomes are a little bit disconnected when they are learning remotely. So we try to work with them the best that we can. I think that both Laura and Phyllis have some probably good examples of things that they have done to try to get them to engage and to be part of the solution. But I think right now, because we're in this process, they're not quite there. This has been a very trying time for them. And correct me if I'm wrong. It's for all of us, but for especially the young learner, it's been very tough. I don't know, Phyllis and Laura, do you have anything to add to that?
Well, I'm reminded, Pat, of that Confucius saying, I hear and I forget, I see and I remember, I do and I understand. And to Chris's question, and I don't know if this was it was exactly what you were looking for, but what we have done is have the students actually develop their own very short, a minute or less, videos of teams going right and teams going wrong from practice. So real life examples. So getting them involved in the process, if you will. And actually those debriefs are very rich when they're their own. So, and then have students conduct the debriefs. So it's almost like teach one, show one, and then have them develop one. So definitely, what we've learned is to get them as involved as possible in whether role play, after the theory burst, etc. But it's really helpful, and they come up with some really interesting things face to face, and you can do that online as in breakout groups as well.
That's great. More of getting more into like nitty-gritty type questions. I know we talked about some expectations around cameras on, cameras off, their dress. How do you go about having them answer questions? So very specifically, do you have them chat in answers? Do you have them raise their hand and say them? What's the best way for a good class flow and to get people involved?
I think that's highly dependent on the size of the class. Certainly if it's a smaller class, they can verbally respond. If it's a large class, I have them kind of raise their hand, give that hand up. For them, the questions in the chat room, I think they tend to do well with those. However, people tend to miss some of the responses in the chat room. I think one thing as far as going to the questions that you have to be willing to do in the virtual environment is wait out that deadly silence. That's tough enough sometimes to do in the classroom, but it seems that tends to be a little more prolonged sometimes in the Zoom setting. And I think you have to have that increased patience and increased awareness. Sometimes there's a delay in responses because the students aren't sure which student should be responding or what the order of the responses should be. So again, if it's a large group, certainly that raising the hand and then calling on that individual. But if it's a smaller group, you can really engage more in that group conversation.
And Phyllis, I would agree. It does depend on your numbers, but I know one thing that has been used is the word wall wheel, and have the different participants' learner names on there. And you actually just kind of click a button and spin the wheel, and they get the question, that type of thing. That avoids talking over each other, etc. Then there's the virtual thumb ball, and they can throw it to each other. No one can be repeated twice, that type of thing. So, I know that this is a little tricky, but it can be done online, as well as converted to a face-to-face as well. But, again, there's something about that wheel that they love.
That's great. I love that. And I think calling people out is so important because you have this phenomena, I think, of people looking very attentive at the screen, but they're actually not paying attention, right? They're reading something else, watching something else. These I've seen multiple times when a class finishes and there's somebody still hanging out, and you're like, Joe, you can go, and it's just that person is not actually paying attention. They're watching something else online, but it looks like they were paying attention. So I love that calling out. It's great.
Chris, that's true, and that interspersed warm-ups or icebreakers, really important to kind of bring back that level of engagement we've found. And they can last for just a couple minutes, and some ideas were presented here, and I look forward to seeing some ideas generated on Mighty Networks from the chat room. I think people are sharing ideas as we speak, so this is absolutely great. But that level of engagement you want to keep, and it's so important, especially for team training, as we know.
So my last question is, and so much of this has been, getting through these stormy seas, but let's end on a positive. What's better, if anything? Is there anything that's better because of being in this virtual education environment?
I think getting students to meetings is much better because they all can join via Zoom and don't have to worry about coming in to class. And I think the opportunity, I doubt that there'll be a snow day again in the future here in Cleveland, as we can continue to provide, Zoom or opportunities for virtual classrooms. So I think having that flexibility has been wonderful for us anyway. I think it's going to prove to be even more beneficial as we move forward because absences, not feeling well, all of those things will provide us with the opportunity to stay connected with our students no matter where they are.
That's great.
And I also see it has provided a much easier aspect of obtaining those interprofessional experiences with students. It is much easier to bring different disciplines from different places to meet virtually.
Love it. Well, thank you. I think we're at the top of the hour. I really appreciate the presentation today. Just some final reminders. We'd love for you to complete the evaluation. That will be sent to your email shortly. Evaluations are really important to us. We take a look at them. We definitely share them with our speakers. And then continuing education credit, please make sure to download that chat pod to download in the files pod the information about how to get CE credit. It's here on the screen as well. So there's that. Without any further ado, I'd like to thank Phyllis, Pat, and Laura for their great presentation today. I'd like to thank you all for joining us today, and a very happy Veterans Day to everyone, and a very special thank you to all the folks who have served in our armed forces or are currently serving. So thank you all.
Thank you, Chris.
Thank you very much. Ladies and gentlemen, at this time, this now concludes our conference. You may disconnect your phone lines and log off the webinar. Thank you and have a great rest of the week.